cupping. We're going to talk about cupping today. So we'll get into what is cupping and how does it work. But we probably should start with just like setting the base anatomy, and then we can get into it. So do you want to talk about like the base anatomy that is important to understand prior to cupping?
Yeah. So basically, you have multiple tissue layers around your body. So on your outside, you have your skin, and there's several different layers to your skin as well. And then you have muscles, but then you also have fascia. And so fascia surrounds and actually interpenetrates bones, muscles, nerves, your vessels, and it creates this compact mass. So basically your body's just not like sloshing around all over the place. Like it's compact. And this fascia is the primary guy that we're messing with when we talk about cupping. So with the fascia, it's made of collagen and elastin fibers. And basically these fibers are suspended in this fluid. And the fluid is called ground substance. And it has a viscosity, a thickness that changes, and it gets thicker when there's like increased stress to those tissues. And basically all of this fascia, it connects muscle synergists, so muscles that act together and want to do the same movements. But it also provides for anatomical and directional continuity throughout your movements. And then in the fascia, there's these things called mechanoreceptors. And basically these sense tension. So whenever there's, like you extend your arm, there's tension created in that fascia, and it relays that information to your brain and spinal cord.
So that's like the base anatomy to kind of understand what we're getting ready to go into. So what is cupping? How does it work? What does it look like?
So first I apply the cups. And when I apply the cups, it's decompressive in nature. So basically I'm separating those tissue layers versus a massage, which is compressive. And I'm using my hands to create different pressures and thicknesses and addressing those different layers and stuff. So I'm separating those tissue layers. Well, that also manipulates the viscosity of that ground substance. So when I do that, it becomes more thin. And when the ground substance is thinner, it creates more viscoelasticity. So those tissues actually are able to move more freely. And then also, since there are those mechanoreceptors, I'm creating some like neuromuscular changes due to that mechanostimulation. And then also you can treat like straight trigger points and just taut bands and all of that with the cups.
Are the cups, what are the cups made of?
So there's different materials. The ones that I use are like a plastic.
Okay. And then whenever you apply them, how does that separation happen? Is it like an air pocket, or how are you doing that?
So it's a pump. So I like create that negative pressure in the cup. And so it just like pulls those apart.
Yeah. So if someone's ever never seen it, which we may have a reel or a video or something, maybe I'll try to put it on this. But if someone has never seen it, they just go like look up a picture or video. It's actually like, it's almost like the skin is lifting up inside the cup.
Does. So you're looking for that good dome, but then the tension in that area is actually around the edges of the cone.
Okay.
Yeah, of the cup. So the center of the dome isn't like where the magic is happening.
Right, even though you would think that that's where it is.
It's around the edges.
That's really interesting. Cool. So someone is going to come in and maybe a part of their plan of care is to have cupping. What should they expect?
So they'll come in and we'll do the full assessment. We're going to identify painful or taut areas and then the trigger points. We'll look at restrictions and limitations in their active and passive range of motion. Then when we decide we are going to do cupping, I'll start with like just some gentle soft tissue mobilizations, moving tissue, moving fluid, getting my hands on you, to one, get you more relaxed and comfortable so you know what's happening. And then also I'm using that time to spread the cream that you need for the cupping. The cups, like when they suction to you, you want a good thick cream under that so you create the seal. And also it's more comfortable because I do dynamic cupping, which is movement.
Okay.
So you're going to be greased up really good.
Yeah. So it slides a little better.
Yeah. So then from there, like we're targeting those regions with the cups, and I'll put them on. And then initially I'm just going to like let you sit there for just a second, get used to the sensation. That's called static cupping. And then from there, we're going to go into different movements. And that'll be like range of motion movements, or it can be like resisted movements. A lot of times I'll have bands out and like we'll do some resistance with it. But also I can glide and drag the cups to do different things that I'm trying to target. So like if I want a big broad area done, I'll put them on and then I can start working through and gliding the cups. I'm not going to lie, it's not the most comfortable sensation in the world.
Oh, I know.
But there are great therapeutic benefits from it. So, gliding, movement, all of those are huge factors in it. And then when I take the cups off, you're going to get more of that soft tissue mobilization. So I'm going to kind of clear the area, make sure blood flow is restored and all of that.
Yeah. It's funny that you say that about how it might feel, because there's sometimes like where I maybe come to you and you're like working on me, or you're going to do cupping or needling. And I'm like, in my head, I'm like, I don't like it, but it works. So let's get it done.
I know. And I always feel bad, but I also I don't want to preface and be like, oh, this is going to hurt.
Right.
I don't want you to go in blind either.
Yeah. And also I think it probably is like injury specific, and then like what level they're at currently. And
absolutely.
Because there are some times where it doesn't like give like a bad sensation or anything, Yeah. So cool. So is cupping something that you do alone, or is it something that you can pair with other things, or how does that work?
Yeah, so like I said, when I put the cups on, you will be moving with them. And that's a little different than what you might get at in a massage. Most massage therapists typically do like a static cupping, and we do dynamic. So you're going to get the cups, you're going to get movements. But you can also do like the dry needling and the other modalities and treatment approaches that we use in your regular session. We'll do it all the same day.
Okay, cool. That makes sense. And then, so the thing that everyone has seen is the big pepperoni circles on people's back, and they think like, what the hell is that? So tell us, Michaela, what the hell is that?
So they're not scary. They're just marks, pretty much. It's basically just the blood from the capillaries in that area. So the small little blood vessels basically just kind of like pop, and you get blood congregated there. The color of it doesn't make that much of a difference to me during the treatment. What I'm looking at is the quality of your tissue. So is it thickening looking? We call it porosity. Are your pores maintaining their shape, or are they kind of getting blown out and just it looks thick in that area? And then are there indurations or craters? So when we create that dome, is it smooth and rounded, or are there dimples in it? If you put a cup on an area that's close to a bony landmark, you will have those dimples and restrictions naturally. So you have to know your anatomy and be aware of that. But if that is present in like a muscle belly area, that's when there's a problem.
I see. Very cool. So then once you have the cupping done, is it okay to work out like the same day or the next day?
Yeah, absolutely. Like I said, like you're going to be moving with the cups on, so working out after is totally fine. You might be a little sore and you want to drink plenty of water, but other than that, do the workout.
Cool. Is there anything else?
No.
All right.